to our new YouTube channel Pharmatech, the division of excellence. So let's start to the new subject, that means second most important subject in GPAT, which is pharmacology. In pharmacology there are various topics, so we arrange the topics accordingly to the major and then next minor topics. So we start with the first major topics in pharmacology, which is autocoids. So let's start to the chapter autocoids. These are the substances produced by wide variety of cells that act locally at the site of production. Autocoids are classified as mainly in three types. The first is amines, in that histamine and serotonin. The second one is lipids, in that prostaglandins and leukotrienes and also platelet activating factor. Then the third is peptides, in that the bradykinin, angiotensin and kallidin. Then next we see the first autocoids in amines, which is histamine. The histamine is synthesized from amino acids, that means histidine, and is stored within the storage granule of mast cells. It acts mainly on H1 and H2 receptors. Recently, H3, also known as presynaptic, and H4 receptors have also been isolated. Then next we see the actions of histamines. The first action is it causes dilation of small blood vessels and can result in flushing and hypotension. Fall in blood pressure is mediated by both H1 early as well as H2, that means delayed and persistent receptors. It increases capillary permeability and result in edema through stimulation of H2 receptors. Intradermal injection may result in triple response consisting of red reaction, that means due to vasodilation, and wheel is exudation of fluid due to increased permeability, and flare, it means the spreading redness due to axon reflex. It is primarily an H3 response. The H1 receptor stimulation has negative dromotrophic effect, whereas H2 stimulation increases the force of contraction of isolated heart. Effect on intact heart is not prominent. Histamine is a powerful contractor of visceral smooth muscles through H1 receptors and results bronchoconstriction and abdominal cramps. Histamine increases gastric secretion by stimulation of H2 receptors. It stimulates nerve endings and may result in pruritus and pain. Histamine synthesized within the brain stimulates reticular activating system and maintains wakefulness through H2 receptors. And it serves as a mediator of inflammation and hypersensitivity reactions. The beta-histine is an oral histamine and causes immediate type of hypersensitivity reactions. Some basic drugs like D-turbocurarine, morphine, atropine, vancomycin and polymyxin B, etc. may result in histamine release. Then next we see the H1 antihistamines. That means the first one is H1 antihistaminics. These drugs act as competitive antagonists at H1 receptors. These may be classified into first generation and second generation compounds on the basis of CNS penetration and anticholinergic properties. The first generation antihistaminics are classified in three types. The first is highly sedating, in that diphenylhydramine, diphenylhydrinate, promethazine, hydroxyzine and doxepine. The next second one is moderately sedating. The examples are pheneramine, cyproheptadine, meclizine, buclizine and cinerazine. The next one is mild sedating. The examples are chlorpheneramine, that means chloropheneramine. The second one is myramine. Third one is cyrilizine and fourth one is cyralizine. Next, the based on H1 blocking action, the allergic conditions like itching and insect bite, IV poisoning, and to present the adverse effect due to histamine releasers. And second is based on anticholinergic properties. In that, the common code to control rhinitis. The second is motion sickness as prophylactic agents, and Parkinsonism, that in that the promethazine may be used. So the other uses are antihistaminics are the drug of choice for idiopathic pruritus. So in idiopathic pruritus, the antihistaminics are the drug of choice. So next, cinnarizine is useful in vertigo. So next we see the adverse effects. Major adverse effects of first generation agents are sedation, psychomotor impairment, and anticholinergic effects. That means dryness of mouth, blood vision, urinary retention, and constipation, etc. So next is the uses of second generation antihistaminics. These drugs have little CNS penetration. That means it do not cause sedation and do not possess anticholinergic activity. Some drugs like cetirizine and azelastrine possesses additional anti-allergic mechanisms. These drugs lack sedation and it can be used in truck drivers. So next we see the important drugs in histamines, that means in autocoids. The first is tipinadine. The tipinadine is the fastest acting antihistaminic drug. In overdose, it blocks cardiac delayed rectifier K+, that means potassium channels, and may result in polymorphic ventricular tachycardia, that means Tosarders D plus pointers, also known as Tosarders D plus pointers. So and is manifested as prolongation of QTC interval. Use of this drug with microsomal enzyme inhibitors like ketoconazole, erythromycin, clarithromycin, and itraconazole increases the risk of this arrhythmia. Tipinadine is metabolized to an active metabolite fexofenadine. It available as a separate drug that lacks of K plus channel, that means potassium channel blocking property. Then the next second important drug is astemizole. The astemizole is the slowest and longest acting agent and possesses arrhythmogenic property similar to terfenadine. Therefore, it should not be administered with ketoconazole, erythromycin, clarithromycin, and same itraconazole. Then the third important drug is loratadine. The loratadine is another long-acting second generation antihistaminic and is metabolized to desloratadine and it available as separate drug. Then the next important drug is cetirizine. The cetirizine is an active metabolite of a first generation antihistaminic drug, hydrozine. So all second generation antihistamines are metabolized to active products except cetirizine and mesolastine. It possesses additional anti-allergic mechanisms like inhibition of release of cytotoxic radiators from platelets and inhibition of chemotaxis. Some persons acquire sedative effects with cetirizine. Levocetirizine is L isomer of cetirizine that is more potent and less sedative. The next important drug is azelastrine. The azelastrine possesses the maximum topical activity and can be given by nasal spray for allergic rhinitis. The next important drug is mesolastine, ibastine, levocabastine, ruptidine, Acrevest, and oloptadine are other second generation antihistaminic agent. The examples of second generation antihistaminic agents are mesolastine, ibastine, levocabastine, ruptidine, Acrevest, and oloptadine. So the oloptadine is a recently approved topical H1 antihistaminic use as spray for seasonal allergic rhinitis. Then the next important is serotonin. It is 5-hydroxytryptamine. Serotonin is synthesized from tryptophan. It is produced by hydroxylation followed by decarboxylation of amino acids. That means tryptophan steps similar to catecholamine synthesis. It is similarly stored in the vesicles and its action is terminated by reuptake. It acts by activation of several serotonin receptors, that means 5-HT3 and HT2 receptors, and the action of serotonin is on IV injection. It produces triphasic response on blood pressure. Early sharp fall, that means due to Berzod-Jarist reflex, then brief rise, that means due to vasoconstriction, followed by prolonged fall, that means due to arteriolar dilation in blood pressure is seen. The serotonin is a powerful stimulator of smooth muscles. The serotonin is a powerful stimulator of smooth muscles. It increases peristalsis and constricts bronchi, and it has gastroprotective action of decreasing acid secretion and increasing mucus production. The 5-HT is involved in regulation of sleep, cognition, behavior and mood, and the serotonin increases the platelet aggregation. So here is the first part of autocoids is end. So next we see the second part of autocoids. So in the second part we see the classification of 5-HT receptors and also the non-selective drugs and other ergot alkaloids. So here we stop in part 1. So hope you like this video. Please, if you like this video, please share this video to your GPAT aspirants as well as CET aspirants. So, and also like, share and subscribe to our channel for more important updates in pharmacology. So stay tuned. Thank you for watching. Thank you. Stay tuned. Welcome students.